Order, order. Ronnie Cowan to move the motion.
Thank you very much, Ms Ryan. Nice to see you again. Let me start with a few undisputed facts. Drug deaths due to overdose are increasing year on year in the United Kingdom. People have been taking drugs of various types for thousands of years. In the last 100 years or so, we've run a campaign to criminalise, persecute people that take certain categories of drugs. We decide what drug does or does not belong in a certain category. Some criminals have become staggeringly rich through their involvement in the production and supply of drugs. Users are stigmatised as junkies, crackheads and stoners. Society adopts this language to dehumanise and ostracise sections of a community. This facilitates their abuse and allows them to be used as scapegoats. So where are we now? The drive to arrest and incarcerate the producers, distributors, dealers and users, often referred to as a war on drugs, has seen a massive increase in violent crime and corruption, along with hundreds of thousands of deaths and the criminalisation of some people for the most minor offences. The perceived problem that the war on drugs set out to solve has in fact been compounded by the war. As a result, time, money and lives have been wasted.
Called. The sitting is suspended until this series of votes is concluded. When that series of votes is concluded, the sitting will be resumed 5 minutes after the announcement of the result of the last vote in this series.
Thank you very much, Ms Ryan. And as I was saying before we were so rudely interrupted, we created this situation and we can fix it, but it will take a change in attitude at governmental level to do so. Rather than paying lip service to people with an addiction, we need to start listening to what they are asking for. We need to treat addiction as a health issue, not a criminal justice one, not just in part, but in its entirety. One part of the solution is drug consumption rooms. Supervised drug consumption facilities where illicit drugs can be used under the supervision of trained staff have been operating in Europe for the last 3 decades. These facilities primarily aim to reduce the acute risk of disease transmission through unhygienic injecting, prevent drug-related overdose deaths and connect high-risk drug users with addiction treatment and other health and social services.
On that point?
Certainly.
For giving way, but would he agree with me that indeed one of the big strengths of DCRs is precisely in reaching those people with drug addiction problems who aren't otherwise known to the services? In other words, if we can begin to build relationships with them over time, then when that trust is there, it's much more likely to be able to get them into the kind of services to begin to really address the reasons for the addiction.
I completely agree. It's one of the steps in the beginning of the healing process. If you can build a working relationship with people and earn their trust as they'll come back for you without the suspicion which we've built around drug users in general. They also seek to contribute to a reduction in drug use in public places and the presence of discarded needles and other related public order problems linked with open drug scenes. Typically, drug consumption rooms provide drug users with sterile injecting equipment, counselling services before, during and after drug consumption, emergency care in the event of overdose, primary medical care and referral to appropriate social health care and addiction treatment services. Currently, people are sharing needles, using a product that may kill them instantly and living a chaotic lifestyle that harms them, their friends and their families. DCRs provide needles instantly. We reduce the spread of HIV and hepatitis C. Instantly we improve the health of the user and instantly we engage users back into society where they can be signposted to relevant services. Needle exchanges also go some way to doing this, but as the paraphernalia leaves the premises, it is often discarded in public places or shared with other users. And users may choose to inject themselves in streets, doorways or gardens near to the exchange. This is unsuitable for the users and the local residents. But the great thing is that we have evidence from 10 other countries that DCRs work. The first supervised drug consumption room was opened in Bern, Switzerland in June 1986. Further facilities of this type were established in subsequent years in Germany, the Netherlands, Spain, Norway, Luxembourg, Denmark, Greece and France. And outside Europe, there are facilities in Australia and Canada. A total of 78 drug consumption facilities currently operate in 7 EMC DDA, European Monitoring Centre for Drugs Addiction, reporting countries. I'll give way.
I'm grateful to the Honourable Gentleman for giving way, and I congratulate him on securing this important debate on a potentially a controversial subject, but perhaps one that we need to really look at the evidence. And would he agree that not only are there health benefits, but there are benefits in terms of crime prevention and reducing crime? The Home Office's own figures say 45% of crimes are caused by drug users stealing in order to feed their habits, and there will be considerable benefits in terms of tackling that through the introduction of consumption rooms.
Absolutely. The closest thing we've had to this, in my knowledge, in the UK was opened by John Marks in the world back in the 1980s, and at that time local crime dropped by over 90%. We have the information at our fingertips. But most interestingly, no country that has adopted a DCR have ever regretted it and subsequently closed them. Switzerland and Spain have closed DCRs, but only because the need for them reduced significantly. They were so successful that they put themselves out of business. Before the festive recess, I asked the Prime Minister at PMQs to change the law to facilitate DCRs in the UK. And if she won't do that, then devolve the relevant powers to the Scottish Parliament so the Scottish Government can do so. The law needs change to protect the people that supervise the rooms and enable the relevant police forces to take a consistent stance which does not set them apart from the rest of the judicial system. Certainly.
I'm very grateful to you. Like my friend has just spoken, I think the evidence is really important on these issues. I'm confused about the position in Scotland where criminal justice is devolved. And the Honourable Gentleman has just referred to the devolution issue. Can he clarify for me, I'm genuinely interested in this, why this step has to be taken by the UK Parliament?
There are certain aspects of the law which are not devolved to Scotland. The laws we require, so as people can work in these facilities with impunity, still rest here at Westminster. So I want those laws devolved to Scotland because we have the appetite there to do this job. President, 1 minute. The Prime Minister's response was that she knows some people are more liberal about drugs than she is, but she's not minded to do anything, which completely misses the point. This isn't about a liberal attitude, it's about compassion and treatment for vulnerable people.
For giving way. Before we move too far away from law enforcement in Scotland, can he explain, if you were to get these powers devolved, what would be the police's response? Would they be asked to, ignore people in possession on their way to these venues, regardless how far away from centre they were? What this would do would give the police the authority to stay within the law. We're not asking them to turn their eye on people who are breaking the law, but the laws would allow people to carry in their own drugs. The limit from which you can carry a drug has not been defined. The point is that the Scottish Government and the Lord Advocate has asked for this facility to happen. The alternative would be that we've got people shooting up in alleys and contracting HIV and hepatitis C. If that's the alternative that you want to see in Scotland, it's not what I want to see anywhere within the United Kingdom. So nobody is saying that drugs are for everybody and that drugs are great. What I and many others are saying is, if we want to stop damaging society and help the many individuals that have a drug addiction problem, then we need to change our approach. DCRs are not a magic wand or a silver bullet. They will not resolve every issue, but they are humane, productive and cost-effective. The total operating cost of the Glasgow Safer Drug Consumption Facility and Heroin-Assisted Treatment Facility are estimated at £2.3 million per annum. A 2009 Scottish Government research paper suggests that in 2006 the cost attributed to illegal drug use in Scotland was around £3.5 billion. The Vancouver Insight DCR cost the Canadian taxpayer around £3 million per year. The facility claims that for every dollar spent, 4 are saved as they are preventing expensive medical treatments for addicts further down the line. This is a figure recognised in many other countries. A 2011 ruling by the Supreme Court of Canada concluded that the Vancouver Insight Safe injector room saved lives with no negative impact on public safety in the neighbourhood, and that between 8 and 51 overdose deaths were averted during a 4-year period. A study in Sydney showed that there were fewer emergency call-outs to related overdoses at the time safe injector rooms were operating. A study of Danish drug consumption found that Danish DCR clients were empowered to feel more like citizens rather than scummy junkies. Their words, not mine. These findings corroborate other investigations as being an essential step towards preventing the marginalisation and the stigmatisation. NHS GGC estimate that the annual cost to the taxpayer of each problem drug user is £31,438. They further estimate that the introduction of a new heroin-assisted treatment service could save over £940,000 of public money by providing care for just 30 people who successfully engage with the treatment. So even if we didn't give a damn about the people with addictions, it makes good financial sense to provide these facilities. It is more cost-effective to provide DCRs than it is to pick up the bill after the damage has been done. DCRs are more than just a practical solution. They are humane, compassionate and financially effective. I can think of about 2 reasons why the UK Government is so resistant to this proposal. Either they are stuck in an ideological mindset that people with addictions are not ill, they are the product of poor lifestyle choices, or the UK Government simply doesn't care. The UK Government has stated it is for local areas in the UK to consider, with those responsible for law enforcement, how best to deliver services to meet their local population needs. We are committed to taking action to prevent the harms caused by drugs use, and our approach remains clear. We must prevent drug use in our communities, help dependent individuals recover, while ensuring our drug laws are enforced. This cowardly stance simply underlines the UK Government's disengagement from the reality of the situation. It pushes responsibility onto the shoulders of local administrations and the police force, who are refusing to furnish them with the legal powers to act responsibly within the law. Home Office-led international comparator study in 2014 concluded that there was some evidence for the effectiveness of drug consumption rooms in addressing the problem of public nuisance associated with open drug scenes and in reducing health risks for drug users. The EMC DDA European Monitoring Centre for Drugs and Drug Addiction considers that on the basis of available evidence, DCRs can be an effective local harm reduction measure in places where there is demonstrable need. But despite that evidence that financially DCRs are viable, the United Kingdom's government has chosen to ignore the evidence. Can the Minister please tell me why? And in conclusion, I shall once again ask, will the UK Government look at the growing body of evidence and change the law to allow DCRs to be opened in the UK without fear of prosecution, or will the UK Government devolve their relevant powers to Scotland to allow the SNP Government to pursue ambitious and innovative new methods to tackle the public health issues of unsafe drug consumption?